Oh, it's up there. Okay. Okay, well, thank you for that introduction. There's been some great talks this morning. Peter, I particularly enjoyed that one. When I talked to Jeff, he wanted me to talk about the future of food, so I think there's a component of that in here. But I wanted to talk about the carnivore diet, and I call it demystifying it, because there's a lot of, I guess, mythology around this diet. I hear a lot of things, and sometimes I just kind of shake my head when I hear some of these things. So I have some disclosure. I'm a co-founder and CMO of something called Rivero Health. Our mission is to use lifestyle nutrition to treat and or reverse chronic diseases. As it was mentioned, I'm the author of the Carnivore Diet, and I am an unashamed and avid meat eater. So I just, I'm not bashful about that, as you guys may know that. All right, and so I'm going to do a little bit of stuff. I'm going to put you guys to work a little bit, and so we're just going to ask some questions to get a little audience participation going here. So hopefully most of you guys are alive. The first question, I hope all of you get right. So I want you to raise your hand, and we'll have you successfully lower it. The strongest people will be the ones that survive at the end here. So. Anyway, so the first question, raise your hand if you're a human being. So most of us have yes, so there may be a few aliens. So just leave them up there if you're a human being, okay? So the next question I have for you is, have you increased your meat intake over the last several years? Anybody's done that? So most of you done, that's a good sign. Okay, the next question is, if you've done so, has your health improved somewhat or significantly by doing that? So most of you have increased your meat intake and you've seen an improvement in your health. How many of you, and leave your hand up if this is the case, you've also cut back ultra-processed junk food? I mean, most of it comes out. So clearly getting rid of that stuff. And then here's the final question, which is the kind of the differentiator. How many of you at the same time have actually cut back on fruits and vegetables at the same time? So some, but not all. But see, there's a significant number of you, and this is the exact opposite advice we've been told. Okay, so let's talk about thank you for doing that, by the way. All right, let's talk about some carnivore diet myths that are out there. You can eat unlimited foods and you will lose weight automatically. I hear people saying that all the time, and indeed that does happen. There are a lot of people, they just can eat as much as they want and they actually lose weight, but it doesn't always happen, okay? The other thing, and I know Dr. Chafee here's gonna be mad at me for this, but all vegetables are poison and no one should eat them. I don't necessarily believe that's true. I think there's definitely room for that to happen, though. And then the other thing that's kind of controversial, organ meats, grass-finished meat, or organic meats are essential. The only way you can be successful in the diet is by doing those things. That is something that does not seem to be true. And then this is one that's kind of beaten to death, but serum cholesterol, I hear people say, is irrelevant if you're on a carnivore diet. I don't agree with that. Now, there's some caveats to that, and some of the guys, Dave Feldman, Dave Diamond, have kind of shown some of that stuff, but I think that's important to at least in my perspective, to realize that there are sort of nuances to all this stuff. And so when we talk about unlimited food, calories matter. I mean, I know a lot of people don't like to talk about that, but even on a carnivore diet, like for instance, if I eat 5 ribeyes a day, I'm gonna be bigger than if I eat 2 ribeyes a day. There's just no getting around that. It's a lot easier, particularly with the cost today, to eat 2 ribeyes a day, because 5 gets pretty expensive. And it's also, it's challenging, as someone who's done this, to eat 5 ribeyes a day is a hard task. And so there's things that go on. So it doesn't preclude the fact that there are hormonal influences by the type of food. The macronutrient composition will definitely make a difference. We know, even Lane Norton, I don't know if Lane's here, but even Lane Norton would agree that higher protein diets are going to have a different effect on our metabolism. And then, if we've got, Dave Ludwig was here, or Gary Taubes, they would argue pretty vehemently that there's a difference between carbohydrates and fat. And I think that, in my view, is still controversial. I think there's evidence on both sides. But clearly it makes a difference. The microbiome has an impact. I don't know if, a lot of people have been criticizing. There was a study that Dr. Mozaffarian just released from Tufts University talking about how Lucky Charms are better than ground beef and eggs, and all of us would disagree with that, I'm assuming. But one of the articles he put out, he talked about the fact that this is about 1960 to about 1990, it was pretty clear that we started eating more calories, about a 350 calorie per day increase per person, and that explained the obesity epidemic. But the problem with that is, since about 1990 to today, there's really not been much of an increase in caloric consumption. In fact, it's been pretty flatlined, and yet obesity continues to grow and grow and grow. And one of the thoughts on that is that our microbiome actually eats some of our food. So we're feeding ourselves, but actually our microbiome's eating some of that food. And so when you turn food into powder, and it's much of processed food, you think about the processing of flours and sugars, even things like protein powders. If we were all, trapped in the wild and said, go get some food, none of us would bring back powder. I mean, it just doesn't exist. We can't make powder with our teeth. I mean, I guess you could sit there with your teeth for like 6 hours, but we're not supposed to ingest powders. And so those powders have a higher absorption rate because of the higher surface area. So the microbiome kind of gets robbed a little bit. And so now we're maybe absorbing more calories relative to what we were before because we have so much powdered food. And then, of course, I know Andreas was talking about satiety, and obviously the quality and types of food have different effects on satiety. And so those are important things. 2,000 calories of donuts is very different than 2,000 calories of steak. I don't think anyone would argue with that. But once you get to an all-meat diet or a limited ketogenic diet, we're eating the same thing. Within that context, more food equals more weight, less food equals less weight. And the problem is, how do you convince yourself that you don't need as much food? Satiety has a big role in there, and I'm certainly a big fan of that. Poison vegetables. I don't eat them. I haven't had vegetables. I literally have not had vegetables since 2016. I'm not dead, believe it or not. And I think that there are compounds in vegetables that can be problematic for people. I clearly see that every single day. I literally spend 7 days a week talking to people on diet and nutrition, and I see them every single day that they go on a quote-unquote healthy diet, a ketogenic diet often, and sometimes they have to get rid of the vegetables, and they see improvements in health. So something is going on, but, there are billions of people throughout the planet that eat vegetables every day, and they do pretty good. So to say that all vegetables are poison, then all these people should be dead. So you can't, I don't think you can make that argument compellingly. I can't even convince myself of that, and I'm a no vegetable guy. Perhaps what we're seeing is there's some sort of gut compromise. I think a lot of these health issues start in the gut. I mean, that's pretty clear, and it has downstream effects. It might be that the modern diet that we consume has so compromised our gut that even eating something as simple as a strawberry causes problems for some people. And it sounds crazy, but I literally see it almost every day of my existence. So there's something going on there. Okay, organic versus organs organic. I've got data on 12,000 people who have done this diet, and I've shown it before. I am very sort of eat what you like, eat what you enjoy, eat what you can afford. If you want to eat, if you want to eat raw testicles and get on Instagram, go for it. It's not my thing. But the data we have, 12,000 people, no real difference in outcome. Now, there's a study from Harvard University. Some of you guys may be familiar with that, and I'll put it up here in a second. Same thing. That was one of the. It's in the text, and I asked one of the researchers, Belinda Leonards, to please ask that question, and she did, and they found that organ meats, organic meat, grass-fed meat made no difference. And I know some people are mad to hear about it, but it made no difference in the outcome with regard to nutritional deficiencies, health outcomes, whether or not they came off medications or not. It just didn't make a difference. And it's not that I don't think there's some advantages to farming in certain ways, because I think there clearly is. But from a health standpoint, I can't just sit up here and say you must eat this, because I see too many people that eat ground beef from Walmart and they do just fine. And clearly, and I'll credit guys like Stefan von Vliet and Fred Provenza and other guys are doing really neat research looking at how different rearing practices and grazing practices affects the quality of the meat. And there may be something that eventually comes out with that, and I'll be one of the first guys to share that if that ever comes out. But up to this point, the research on humans has been very limited. All I've got is observations at this point. Clearly, I do see that some people will say, hey, I feel better when I consume liver, or I feel better when I eat grass-finished beef. I don't doubt that's true. Now, it may be that some people are particularly compromised. Maybe they were silly enough to be on a vegan diet for years, and they need to they need to boost up their nutrition. But clearly, so that doesn't seem to be essential. And then let me just talk about some of the, and I'll get to the cholesterol one here in a little bit. Some of the reported benefits on a carnivore diet, and there's a lot more. There's, people lose weight all the time. That's pretty clear. We see improvements in quote-unquote metabolic syndrome, remission of a number of chronic conditions. It's similar to ketogenic diets. I mean, diabetes goes away pretty reliably. We see hypertension getting better. Some of the unique ones that I think are really cool, inflammatory bowel disease, so that's Crohn's disease, ulcer colitis, IBS, which is, I think something like we're up to like 15 to 20% of the population is now diagnosed with IBS, which I call it, you're just eating the wrong damn food. I mean, I think that's, they should rename that in my view. Psoriasis is another one, and really we see really good success with psoriasis, rheumatoid arthritis, and as an orthopedic surgeon, I was taught that it was just a progressive disease like diabetes, and you're going to end up, at some point, you're going to get your knee replaced and your shoulder replaced, and your fingers are going to be all crooked and stuff like that. And I've literally seen people with, early deformities actually starting to regain function in their hands, and that to me is super exciting. And Chris Palmer's championed this whole thing about mental health disorders, but same thing, people on carnivore diets. One of the more common things I see are people noticing improvements in mental health, whether it's depression, anxiety, bipolar disorder, even post-traumatic stress disorder, which I think is wonderful that we can actually improve that through nutrition. I saw several people now with Tourette's syndrome, which I thought was one of the craziest things, that the Tourette's syndrome would get better. So many more conditions are improving with this. Again, where are all the studies? Those things are hopefully forthcoming. All of us have heard all of our lives that red meat is bad for us. It's going to give us, cancer, particularly colorectal cancer. It's going to cause heart disease. I mean, that's been pounded in our head for now, I think about 3 generations. So now when you tell somebody, you're eating a pound of steak, they look at you like you've got a third eyeball. And so, and it's clear. I mean, there is a huge, enormous quantity of literature that you can pull up. I mean, if you go to Google and search, is red meat good for you? The first 50 search items are red meat's bad for you, right? You can't even find what you're looking for because it's so prevalent. So this came out, this was Washington University, late 2022, red meat is a health. New study slams years of shoddy research. And I think that's an inherent problem with nutrition research in general. It's just very difficult to do real high quality studies. I mean, it's not like an animal study where you can take a bunch of humans, lock them in a cage, study what they eat and control every variable, and then cut them open at the end and see what happened. I think the IRB wouldn't approve that for some reason. But so we've got this, criticism. I want to introduce this guy, Gordon Guyatt. Does anybody know who Gordon Guyatt is? Anyway, so Gordon Guyatt is an internal medicine doctor, researcher. He's up at McMaster's University. I interviewed him a couple years ago. And he is, by and large, considered the father of what's called evidence-based medicine. So we all talk about this term, evidence-based medicine. Where did it come from? This guy, back in 1991. He was serving as a residency director, and he was getting frustrated because all the decisions, the clinical decisions, were kind of made by, I kind of see this, I kind of see that, and this is what I do. And there was no real organized way of deciding how to treat your patients. So he came up with this term, evidence-based medicine. Here's a little paper on the history of evidence-based medicine, and in the text I've highlighted, it cites him as basically, inventing this term evidence-based medicine, which we also hold in such high regard today. So Gordon Guyatt, the father of evidence-based medicine. So why do I point to this guy? Well, in 2019, this study came out. It was the Nutrix Consortium, which, if you look at the last author on the paper, and that's the senior author, it was Gordon Guyatt, the father of evidence-based medicine. He's the guy that came up with the grade classification. In this paper, Unprocessed Red Meat, Processed Meat Consumption, Dietary Guidelines, what they said, what they had the audacity to say is that just keep eating as much red meat as you normally do. Don't cut back. Eat unprocessed red meat, real red meat, unprocessed red meat, processed red meat. It doesn't matter, because the evidence that would suggest otherwise is so weak, it is so uncertain that we can't make a recommendation against that. Now, what happened was folks at the Physicians Committee for Responsible Medicine, which is basically an organization for animal rights activists. It's basically, as they went out there and they lobbied the FTC, they wanted to sue the journal, the Annals of Internal Medicine, which is considered a pretty high-level journal, and they published, I think, 6 articles based on this data. They wanted them to retract all of it. They went nuts. They said, you can't publish this stuff. This goes against all of our beliefs. We've been preaching for the last 50 years that red meat's going to kill you, and you're saying just keep eating what you're eating. And of course, funding source, they had none. They didn't get funding from industry. And one of the interesting thing was that Gordon mentioned was, if you read the study, on their conflicts of interest, they recommend, they talk about what they eat. what their baseline diet is. Gordon doesn't even eat red meat. He doesn't eat red meat, and he's saying it's fine to eat as much as you want. So I think that's pretty interesting. So if you contrast that to, for instance, a lot of people are familiar with the World Health Organization IARC position paper from 2015, where they declared red meat was a class 2 carcinogen, particularly for colorectal cancer. Something like 30% of that panel was either vegan, vegetarian, or Seventh-day Adventist, and they have a little bit of a bias there. And they didn't declare it. You know, we talked to Professor David Clorfield, who sat on that panel, and he was in the dissenting opinion. He said, hey, we should perhaps disclose the fact that a lot of us are ethically opposed to eating red meat, and they said, no, we're not going to talk about that. So we've got this sort of bias, you know, back in 2015, and now everybody you talk to thinks, because of the World Health Organization proclamation, that red meat is a, you know, driver for cancer. You know, even though, and David Diamond talked about relative risk, 17% relative risk, which is about a 1% absolute risk increase, which is kind of meaningless, particularly when you think about all the other things that may lead to cancer, obesity, chronic inflammation, you know, so on and so forth. So this is a Washington University study. This came out late 2022, so it was in October, just a few months ago. Health effects associated with consumption of unprocessed red meat, burden of proof study. There was a previous burden of proof study where they said something like, red meat increases your risk for like death by like 36 times, like some ridiculous numbers. Like it was incredibly crazy, but they reanalyzed the data, and this is what they had to say: this, while there is some evidence that eating unprocessed red meat is associated with increased risk of disease, you know, its evidence is weak and insufficient. Again, we've got this very, very weak evidence. You know, can you hang your hat on that stuff? Obviously not. They're asking for more rigorous studies. You know, well-powered research is needed to better understand the role that meat has in the diet. And so what I think is that, you know, if we're studying the effects of a single food ingredient, red meat, and the diet has got 700 different, you know, components to that. And does anybody know how much red meat or how much beef the average American eats? You think we were eating like 6 pounds a day the way they go on about it. The average American eats about 2.4 ounces, which is, you know, that wouldn't even get me up 3 stairs. I mean, it's just, I mean, and that's what we eat as Americans, and that's what's causing all the harm, right? This is what they're blaming it on. Disregard the fact that like 65% of our food comes from ultra-processed garbage, right? We're eating, you know, refined grains, sugars, you know, industrial oils, you know, sweets, desserts, potato chips, all that stuff. That's 60% of our diet. And it's 65% of our kids' diet, which is even more disturbing to think about. And so we're going to blame red meat on that. And so what if we just study red meat in isolation, i.e. a carnivore diet? You know, because I think that's a very different question. I mean, if I want to know the effect of something, why would I study 700 different things in there, 700 different variables? So we kind of do that. So is there any research on the carnivore diet? Because a lot of people say there's no research. Well, that's actually not true. So I'm going to show some of the studies that have been done in the last decade or so, and I'm not going to go into them in detail, but the top one is Belinda Leonard's David Ludwig study, which I had the fortune to kind of help them a little bit with. But you know, they looked at 2,000 people that had done the carnivore diet. They were anywhere between 6 months and 28 years, which I thought was incredible. We had somebody in there that had been doing it for 28 years, and the findings were largely people were healthy, they got better. The interesting thing, they had diabetics. 92% of diabetics, type 2 diabetics who were using insulin got off insulin, which I think is extraordinary. You think about billion-dollar drugs and stuff like that. You know, what other intervention has a 92% withdrawal rate of insulin, which is great. Now the criticism of this is it wasn't an interventional study. There's survivorship bias and so on and so forth, and that's certainly acknowledgeable. Here's a study that is still in preprint form, and I don't know if Peter Martin's in here. He's one of the authors on the study, and they looked at something called SIBO, which is small intestinal bacterial overgrowth. Case series of 6 patients, all of them got better. 100% approval. This was a study, another study. This is, I think, out of Costa Rica, where they looked at this autoimmune condition, hidradenitis suppurativa, which is you get these kind of boils in your armpits and your groin, and it's really just a miserable type of thing and very hard to treat. Sometimes you cut it out surgically. Anyway, they had a person on a carnivore diet, and they completely resolved that. And I see that again. I've seen that particular condition resolved many, many times in the people I've encountered. This is a study, Frederic Leroy out of Belgium and Cleo Protegero at UC Merced. just did a survey of a couple hundred, I think 300 people on the carnivore diet. And again, the results were, overwhelmingly positive, These are this is a series of case studies, and this is one on cervical cancer treated with a carnivore diet. Here's one on GBM, glioblastoma multiforme, which is a particularly awful brain tumor to get. They've had people surviving. I've interviewed some of them, even up to 10 years now after this, what is usually a very, very deadly brain tumor. A series of 3 more of them. Here's one on, I believe, rectal cancer, epilepsy, which we talked about with ketogenic diets, and then also Crohn's disease. And I've seen all of these. I've seen just in my day-to-day interactions, particularly things like Crohn's disease. My goodness, if you have Crohn's disease or ulcerative colitis, the first thing I do would be a carnivore diet. And it's amazing that in 2023, we still have gastroenterologists who will say these diseases have nothing to do with diet. And I'm like, why would diet not impact your digestive system? It just makes zero sense, but they actually believe this. And it's like, well, just eat whatever you want. The same thing like the American Diabetes Association. Just eat what you want, take a bunch of insulin, and you're good. One of the things I just saw, the American College of Physicians just recently raised their hemoglobin A1C goals from below 7 to between 7 and 8 for diabetics, which is like 8 is an average blood glucose of 183. I mean, do they like cutting off feet, or what are they thinking there? As someone who used to cut off people's feet, it's not fun. You don't want to be doing this stuff. So anyway, that's some of the literature that's out there now. So I'm aware, and I'm trying to help get some of these things off the ground. But there's likely to be some actual interventional trials that are going to be taking place. I know, and I'm not going to share the author's name because they don't want me to mention it yet, but we're probably going to be getting a study on rheumatoid arthritis, ulcerative colitis, and psoriasis with carnivore diets. And we've got funding for that. And so that should be, if the results are what I think it's going to be pretty interesting to see. So we can start to say we've got some interventional trials. There's some other ones that are out there that I'm kind of in the background, like hooking ranchers up with researchers and say, these guys got meat, you guys got patience, let's get it done. So anyway, that's pretty cool stuff. Okay, what about, this is carnivore. You go carnivore, will my cholesterol go up? And the answer is maybe. I tell people maybe, I don't know. And I don't know if maybe Dave knows why does it go up for some people and why does it not go up for other people. Sometimes it goes up, sometimes it doesn't. And then the most important question is, if my cholesterol goes up, am I going to have a heart attack? And the answer to that I still say is, I don't know, maybe it will. And so I think we have to be realistic about that stuff. And so, this was a study, and maybe somebody presented this already, but this is a study that just came out earlier this year, I think even back in January this year. It was a study where they looked at basically LDL and progression of cardiovascular disease in folks with 0 and non-zero coronary artery calcium scores. And basically, they have heart disease or they don't have heart disease. And what they found was that if you had a 0 coronary artery calcium score, your LDL cholesterol was kind of irrelevant. Didn't matter. Didn't change the progression. Now, if you had a non-zero score, what that means to me is you've got whatever it takes to make heart disease, what other factor is there, whatever we want to call it, then LDL did have an effect. And David Diamond showed similar results in some of the other studies he showed. But this is just recently published. And what they interestingly saw that, if you had, like I said, 0 CAC score, your LDL cholesterol could be 200, and it didn't seem to make a difference. And so when people ask me if I'm on a carnivore diet and, is my risk for heart disease up, I always say, I don't know what else is going on, right? I mean, do you have a 0 CAC score? Do you have all these other factors? And they pointed to diabetes, smoking, and low HDL were independently associated, even if you had a 0 CAC score. If you had a low HDL, if you're a smoker or diabetic, your risk for heart disease is still up there. And so what that says to me is, LDL cholesterol, total cholesterol is a dependent risk factor. So it depends, right? So what else is going on there? So what does it depend upon? And this is ground you guys already covered a little bit today, but I didn't know who was going to be talking, so forgive me for the repetition. But metabolic syndrome, and it's always interesting to me that metabolic syndrome doesn't include LDL cholesterol, at least in the traditional definition. Obesity, hypertension, high triglycerides, low HDL, and hyperglycemia, some kind of inflammation, whether you're a smoker, a lot of these inflammatory diseases. And Malcolm Kendrick points out in a book called The Plot Thickens, which I thought was quite an interesting book, that people that have these systemic inflammatory conditions, rheumatoid arthritis, lupus, and things like that, have a much higher rate of cardiovascular disease because we have this, presumably damage to the vessels and the whole progression. Chronic stress. This is something that I didn't appreciate as much until I interviewed Malcolm. He talked about chronic stress plays a huge role in the development of cardiovascular disease, much more than I would have even thought. So it becomes a very important thing. And how do you manage that? There's all kinds of strategies. Maybe everybody needs to be meditating or laying in cold tubs or something like that. Poor physical condition, you're sedentary. I mean, the biggest thing, I'm a big proponent of exercise. I think it's great for everybody to do it, but more importantly, in my view, more important than exercise is avoiding, chronic sedentary behavior. So I tell people, if you're sitting, can you be standing? If you're standing, can you be walking? I do all my interviews, I stand up all the time. Just for that little bit of difference that it makes, and it makes a huge difference. Poor gut health, which is still, I think it's hard to define. I mean, honestly, it's kind of like we're still struggling. I mean, when people talk about the microbiome, I'm like, we're still debating about cholesterol, which we discovered in 1920. And you tell me you've got the microbiome figured out when there's 50 trillion bacteria and thousands of different species, and they change every 15 minutes. How do you define that? And of course, I think all of us at this point know that sleep has been associated with, or poor sleep has been associated with everything from early heart disease to dementia to, insulin resistance. So dependent upon what? So I tell people, what else is going on? And this is an interesting question. So I, have the pleasure of interviewing people almost every day that have gone from, literally wretches of human beings. They're bedridden, they've got MS, they can't even walk out of their bed, or they've got ulcerative colitis and they have bloody diarrhea 20 times a day. Their lives are miserable, right? They're just, and they go and they change their diet. Very often they go on a carnivore diet or a similar, low carb ketogenic diet, and their quality of life improves. It's like they got their life back, right? They're just like, wow, I can live again. I can have a relationship. I can have a job. I have a sense of purpose. I'm not, horribly depressed. And I asked them, so you feel better. What if your risk of heart disease is increased 20%, 30%, 50%, whatever it might be? Would you be willing to change what you're doing because of that? And most of the time, they don't believe me. Like, it's not going up. I don't believe it's going up. But I said, what if it really was going up? Would you change it? And almost without exception, they say, hell no. I don't want to go back to what I was living. So I think that's important as a clinician. We should take that in consideration. And sometimes people are like, oh, I don't, here's what the guidelines say. The HA's telling me you need to be on a statin and you need to eat cardboard and cut out eating the animal fat. And so I think to me, that's one of the most important questions. And we sometimes overlook quality of life. And I think, if I'm going to avoid a heart attack at 70 by being miserable for 40 years, is it worth it to me? I don't know that it is. And a lot of people say it's not. So if your cholesterol high, what do I say? Don't ignore it. Okay, don't ignore it. Get more information. Ask them the important question. What are you willing to do? What are you willing to change? Fix the remaining variables. If they still have metabolic disease, you got to take care of that stuff. Get some imaging. I know Dave had the CCTAs and the CAC scores. I think those are things that are very important. I think these risk factors, particularly serum risk factors, to me, they're like, well, if it changes every 3 days, which number do I use? So I think the imaging is more important. And then adjust the diet if necessary and needed. And you can make adjustments within the carnivore diet to play with your lipids. It's very doable if you want to keep that way. Okay, so fiber. I got to hurry up through this. All right. We're supposed to eat a lot of fiber, 25 to 30 grams. The benefits supposedly include satiety, weight loss, lower cholesterol, which may or may not be of benefit, less glycemic excursions, and favorable effects to the microbiome. This is a study on fiber and weight loss. Basically what they found was 62 trials. The independent effects of fiber outside of calories was that they lost 0.33 kilograms, so like a half a pound. I was like, well, half a pound is, that's not even half a breakfast for me. So, it's kind of like, does it make a difference? And no real change in body fat. This was on cholesterol. Again, meta-analysis of cholesterol lowering of fiber. It was 0.13 millimolars, which is about 5 milligrams. So it's like, does that even make a difference? And do we want to be lowering our cholesterol? A lot of people would say no, right? Hell no, perhaps. So I regularly see people exclude fiber from their diet and they get better. Even though we've been hearing you could eat more fiber before. So why are they getting better? I don't know. I can speculate, but it definitely happens. Some people definitely do better with that, particularly people with gut issues like inflammatory bowel disease, and particularly other autoimmune diseases. For some reason, maybe the fiber is irritative and maybe they're in a hyperinflamed state. and they've got this, porous gut, and it's a problem. So fiber, often getting rid of it helps. It is non-essential. I mean, if it was essential, I would long be dead, and I'm still here, and I would argue I don't think I'm teetering on the verge of death right now, but maybe I am. And I think when we look at all the studies out there, and there's a lot of studies on fiber with mortality, with cardiovascular disease, all these things, cancer. My question is, well, what is it replacing in the diet? What is your comparator group? And usually it's the standard American diet. And so you literally, it's like curing cancer in mice. They say if you can't cure cancer in mice, you need to get out of research. Well, if you can't make people better by changing anything from the standard American diet, you're pretty bad. So anyway, is it a marker of overall diet quality? Okay. This is an interesting study. So this is talking about a high fiber diet synergizing with one of the many millions of bacteria in the gut, Prevotella caprae, making rheumatoid arthritis actually worse, right? Fiber making us worse? That's blasphemy. I'm surprised they got this thing published. But anyway, okay, so let me go back to this side. So the future of protein, because I know we want to talk about the future of food and stuff like that. And so this is a quote from a guy named Pat Brown. He is the CEO of Impossible Foods. His mission, and he's very unashamedly says this, I want all cows, chickens, pigs, sheep, animal agriculture gone by 2035. He's declared that. They're going to replace it. They're going to get rid of it. So all you people that are benefiting from eating more meat, too bad for you guys. You're going to eat the pea protein, right? That was his mission. Actually, they use soy protein, but that's Beyond Meat's pea protein. Anyway, this is what he said. I think the statement was from 2019. So 2035, we're going to get rid of it. So we got 12 years of fun left, guys, and then all meat's gone. But this is from just the other day. They're cutting their people. they're going out of business basically, and I think that is an important thing. I think overwhelmingly the people have said we don't want your hyper-processed garbage. I mean, that's what it is. It really, really is. The other thing is people cell cultured meat. So we're gonna take a little cell from a cow. We're gonna put it in a petri dish and grow it to millions of pounds. And this is what they're going to be pushing for next. When we talk about the inputs for this, what do you feed those cells? They don't just grow out of air. Well, you got to feed them pea protein and soybean protein to get their protein. You got to give them glucose. So you're growing sugar cane and beet sugar. It's very degraded to the environment. They don't have immune systems. A cow has an immune system like you and I, but a cell doesn't. So how do you protect the cells from being contaminated by viruses, by funguses, by bacteria? Well, you put them in clean rooms ideally, but anytime one little bacteria gets in there, and they've got to keep transferring these things. If you look at the process, they have to go from a small bioreactor or from a petri dish to 1 gallon to 50 gallons to 1 million, to 10,000 gallons. They've got to keep transferring. Every time they transfer it, risk of infection. So what do you think they're going to do? They're going to give them fungicides, pesticides, our viricides, antibiotics, and people are freaking out about antibiotics in meat. Well, these cell cultures are going to live in basically antibiotic soup. So that could be a problem. Heating and cooling costs for this, and remember, a cow regulates its own temperature. These cells can't. So you got to have these giant reactors that require tons of fossil fuels. A lot of the people that were investing, that were bullish on this stuff 5 years ago, Silicon Valley has dumped in billions and billions of dollars into stuff, and now they're all starting to have buyer's remorse because it ain't scaling. It's not working. So that's unlikely to be something that's going to happen. And so if you got a cow, you're not getting ultra-processed food. It's solar-powered, it runs in the sunshine. It's self-replicating, right? I mean, they just put some cows in a field and they make more cows. They actually upcycle quality protein, which is a lot of people don't realize this. So they take grass, which I can't eat, maybe some of you guys can, but humans can't really eat grass. The reason for that is the silica content. It's too much silicon in there. It destroys our gut. But they take that low-quality forage that none of us can eat, and they turn it into the most bioavailable, perfect protein that there is. You think about, why do we think it is that all the proteins that we need, and in the ratios we need them in, come from meat? Do you think it's coincidence? I mean, why do you think that is? It's because we're supposed to eat this stuff, right? So anyway, they can upcycle protein, so they can take, and the ratio is 0.6 grams of human usable protein they can turn into 1 gram. So they can upcycle by 40%. So they're more efficient at doing that. They use rainwater. I mean, we hear about, you eat a hamburger, you're using 57, bathtubs worth of water. It's all rainwater. I mean, it's like 98% rainwater. And then in the U.S., most people don't know this, cows produce 2 to 3% of our total greenhouse gas emissions. So it's not nothing, but it's not like the end of the world. You compare that to the healthcare system, which is anywhere between 4 and 10%. So getting people out of the healthcare system, and I think one of the best things you can do as a patient is stay the hell out of the healthcare system. You're going to save greenhouse gases. Anyway, all right. I think I'm out of time. Thank you guys very much. And I think we all have to realize that there's people out there that want to get rid of meat, and we got to fight to keep it. Thank you guys.